So I'd like to share with you my typical week, and I've audited my activity during September so that I can present this to you. I will then discuss some of the benefits of this role to the lupus service as a whole and my vision for the future. And finally, it will be my pleasure to introduce Henna and Katie, who will introduce you to some of the support services and the link services that we provide and tell you about their experiences. Well, the good news is that lupus nurses are on the rise. I've been in post now for 2 years, and I'd like to thank Lupus UK for funding my post for 5 years. Now, the red crosses here on the map represent the nurses that are currently funded by Lupus UK. And the black crosses represent nurses that they've previously funded that have now gone on to being employed by their trust. And this is very encouraging to me that the trust are recognising the value added by these lupus nurses in terms of patient care and service development. So what about the lupus service at Addenbrooke's? Well, the lupus service is sort of split into 2 departments, the Department of Rheumatology and the Vasculitis and Lupus Service. And I work across both departments. And we've had speakers here, Dr. Jane and Dr. Hall, from both departments today. And because many different organs are affected with lupus, we actually use a lot of joint clinics and a lot of other specialists to help us care for our patients. On a Monday afternoon, we join up with Dr. Amanda Cox in the neurology clinic. We send patients to see Dr. Jani in the ear, nose and throat. Dr. Siva Sothi is always a hard one to say, but we call him Dr. Siva. It's our respiratory consultant. And if any of our patients has any eye involvement, then we send them for Dr. Maya. My favourite clinic is the pregnancy clinic. We go to see patients once a month in the Rosie department, and Dr. Hall and both Dr. Jane go there and see patients who've got lupus and we're having a baby. And we mustn't forget the important role that GPs play in doing share care guidelines and seeing our patients out in the community. So this timetable represents sort of my weekly schedule, and the yellow bars take up most of my time. I work 4 days a week, 32 hours. And on Monday I work alongside Dr. Hall, and I do a nurse consultation clinic. I usually see about 5 patients and spend about 3/4 of an hour per appointment with patients. And I'll just give you a sort of an average sort of things that I see patients for. So the first patient when I audited came to see me, they were newly diagnosed. So we talked about information about lupus, we talked about blood tests, about symptoms and how to put the jigsaw pieces together and how the doctors came up with their diagnosis. My second patient that morning was a drug monitoring visit. A patient had started on mycophenolate, and I was doing a review to see that they had no side effects, their blood results were fine, and just to talk about how they were doing on the treatment. My third patient was a response to hydroxychloroquine. This was a 3-month follow-up visit to see if this was their first line of treatment, to see if it had helped them. My fourth patient was managing lupus symptoms, and we've had an excellent talk today on fatigue management, exercise and work-life balance, and this is something I frequently talk with my patients and try and help them in clinic. And my final patient that day was a general follow-up. I see patients in between seeing Dr. Hall, so we can just do a general follow-up, and this patient was well and their lupus was quiet. Patients often can't come to clinic because their work schedule, they have children, they live far away. So some patients, if it's a routine follow-up, prefer a telephone follow-up clinic, and we've been doing these on a Monday afternoon. And the blue squares here show the 2 multidisciplinary team meetings. So if any patients ring in and need some advice, I can often make a list and discuss this with both the consultants at these meetings. On Tuesdays and Fridays, I then move over to Dr. Jane and work in Clinic 12 with Dr. Jane and see patients with him in clinic, and then I can talk to them about any medication changes or any advice they need after that. My background is in research in nephrology, so I was very pleased that part of this post involved a research aspect, and I'll tell you a bit more about this further on in my talk. And education is the other part that I'll come on afterwards. The purple line is on every day, and that's the lupus advice line, and I'll tell you a little more about that next. So the lupus non-urgent advice line's been running now for 2 years, and I'd say it's well utilised, and it keeps me very busy, and I apologise if my phone is frequently engaged. The answer phone takes about 10 calls per day from patients, and in the week that I audited, 3.5 hours per week of my time was spent in calling patients back. 28% of these calls required a further discussion with a doctor, and this is where I might email the consultant, I might actually phone them, or I might put the patient's request on a list to discuss at the multidisciplinary meeting. 40% of these calls that week required a follow-up call just to check that everything had resolved and the patients were fine. So this is during this audit week, these are the sort of calls that I actually took in. So I'll just talk through some of these. So patients ring in with for test results. They've either done blood monitoring at the hospital with me and they want to sort of find out more about their results, or they might have had them done at the GPs and some of the values had gone up or down and they weren't sure if this was important. They should be letting us know. So quite often I deal with these things. One patient had rung in with a low platelet count, and having spoken to Dr. Hall, we felt this was due to a lupus activity and we increased the steroids. A patient rang in with abnormal liver function and neutropenia with azathioprine. Patients often ring in between clinic appointments if they're having a flare, and during that week there was joint flares and skin flares. Infection is another reason patients ring in. They're not sure if it's the lupus activity causing problems or whether it's an infection. So I advise them to ring in and have a chat. And during that week, we had quite a few infections. We had 2 urine infections, a chest infection and a line infection. So for the line infection, I organised for them to come in and have blood cultures. The urine infections, we looked at the sensitivities from their samples and sent them to their GPs. Patients often ring in for appointments that they haven't received an appointment or they need to cancel appointments, so I'm just that point of contact on the end of the phone if they need to sort this out. And patients ring in for advice, and this time of year immunisation is a hot topic, so patients ring in to check whether they should be having their influenza and their pneumonia vaccine. And if they've had this in the past with no problems, then we advise this as anything that can prevent them getting any infections that can flare their lupus is an advantage. And any question, there was numerous questions for consultants, so I won't go into all the details. I'm very pleased that patients can ring me and get to know me in clinic, and then they'll ring me back for emotional support. There's a lot of questions about work-life balance that I'm just on the end of the phone to talk to, and fatigue management. And patients ring in for drug advice. One patient had been advised or had been recommended to start rituximab, and they were working and they just rang in for advice about how this would be set up, about the side effects. A patient rang in with mycophenolate side effects with gastric problems. And 2 patients that week ran in with problems of supply, mycophenolate mofetil. They couldn't get it from their pharmacy, so I was able to call the company and just check if there was a supply issue. So for the research projects, I won't tell you too much about the Illuminate project because that's just now stopped recruiting, but we screened 3 patients for this study. It was quite hard to get patients in because they had to be their disease had to be active and they had to be the antibody levels had to be positive. But we've got 1 patient currently still in the study that will go into the follow-up phase. The study that we're still recruiting for is the biologic study, and this is a sort of a registry study. And it's comparing patients who have started a biologic like belimumab or rituximab with standard care treatments like azathioprine or mycophenolate. We've got 17 patients currently in this study, and we have 3 patients who are just waiting to hear if they can have the rituximab. So if we get yes from the PCTs, then they will also go in. I'm a bit slower recruiting patients in the control group because patients come in, see the consultant, they're flaring, and they get started on treatment straight away. So I need to improve my recruitment in this area. And another study we're just about to start now is we're doing links with the Cambridge Bioresource. And they're interested in how genes influence disease, and they're now particularly interested in lupus. So there's an information leaflet I can give you in clinic. It will involve giving an initial blood sample, and that then gives permission for them to contact you in the future if your sort of gene profile is something that they're interested in. You then will get told about any projects, and then you reconsent if you're interested into future studies. So what are the benefits of the role to the service development? Well, I feel that doing a weekly nurse-led clinic helps to provide individualised follow-up care for patients. And I particularly believe that giving patients 3/4 of an hour gives patients more time to discuss any concerns. I'd like to continue to support and provide information to patients. And in our audit in April this year, we had 595 patients with lupus at Addenbrooke's. And this equated to 2,047 patient clinic appointments in that year. So by being there available in clinic, the patients can then talk to me afterwards about any concerns, about any medication, anything they didn't understand. And as I've already alluded to, the dedicated lupus Nonurgent advice line has been up since August and is well received. And hopefully, by being the first point of contact, I can help patients pick up problems early and, if appropriate, do referrals to other medical team. I was particularly interested in the education part of the role when I first heard the job was being advertised. And since starting in my post, we've now set up 3 education programmes. The first one we've set up was a newly diagnosed group, and this meets about every 3 to 4 months. Once I have a list of 10 patients who are newly diagnosed, we set up a meeting, and it's a morning session. We have a doctor that comes to explain how the normal immune system works and then what goes wrong with lupus. Patients, it's very informal, so patients will talk about their diagnosis, their journey, and they get to meet other patients at the same stage in their diagnosis. The Lupus Young Persons Group, we've been set up again since 2012, and we meet usually about 3 times a year. We actually have 17 patients between the ages of 16 and 24 at Addenbrooke's, and Katie will tell you a little bit more about using this service in her talk. And the final talk that program that we set up last year was the Living with Lupus, and 40 patients came to this, and from the feedback that we got, we plan to do this on an annual basis. I think the feedback was that the patient speakers got the best review at this talk, so I think we'll be inviting patients back to do it again. So what about my vision for the future? Well, the first 2 years in my post, I was more preoccupied with patient care, so I wanted to improve the experience for patients. I'm now looking on to the next 3 years, and I'd like to do additional nurse clinic appointments. I'd like to continue to support the medical team in developing Addenbrooke's as a specialist lupus centre. And we're particularly interested in doing a lupus transition clinic, and I feel we're lacking in counselling support for our patients. So this is a project that we might be looking into. I'd like to continue to participate in research projects. As Dr. Jane alluded to, new treatments for lupus, we need to be actively getting our patients into these studies so that we can be at the sort of forefront of new treatments. And I'd like to be part of raising the awareness of lupus within the trust and within primary care. I suppose my long-term goal is to get permanent funding from the trust, so I've got to prove my value, and so that I can continue to support patients with lupus in the future. I'd like to now hand over, thank you for listening to me, but I'd like to, more interesting now, to hand over to some of my fellow speakers. First of all, I'd like to introduce Katie. I first met Katie back in November 2001 when she was diagnosed with lupus affecting skin, joints and kidney. She was 16 at this, and she's been marvellous, and she's gone on to do her A-levels and starting an apprenticeship, and she's such a role model to the other young people in the group. We started the young people group in 2012, and we've got our 4th meeting next now in October in the half term. So I'll hand you over to Katie to tell you about her role.
Good afternoon. I was diagnosed with SLE 2 years ago, not in 2001.
2011.
And my symptoms included tiredness, hair loss, joint pain and kidney involvement. I'm not going to lie, the first few months were tough, trying to come to terms with my diagnosis. But through meeting other people in the young adults group and listening to their experiences helped me to understand more. In the past 2 years, I passed my driving test, first time, bought a car and held down a weekend job whilst completing my A-levels. Since completing my A-levels, I've managed to secure a place on an engineering apprenticeship programme, which lasts for 4 years. I just wanted to highlight to all of you what you can achieve when you have lupus. However, I don't think I could have been able to achieve so much in so little time without the support of Jane and the young person's support group. Knowing that someone who is trained in lupus and who knows you personally is at the other end of the phone with support and advice is peace of mind. If ever I've had a problem, I've been able to phone Jane up, and she's always been able to sort out any problems or answer any questions that I've had. Nothing is ever too much trouble. At the meetings, we are able to discuss our experiences in a relaxed environment, and it's nice to be able to see everyone else's experiences and see how far people have come in between meetings. I personally like being able to give my support to other people who are going through particularly rough patches in their lupus development. So yeah, that's just a little snippet of what we get up to. It's really informal, and if there's anybody here who wants 14 to 24, they want to come and share their experiences, feel free. Thank you very much.
I'd now like to close the session by introducing Henna, who's diagnosed with lupus a few months after she got married at the age of 19 following 2 bouts of pneumonia. Lupus also affected her kidney and skin, and as you can see from this wonderful photo she's given us to put up, she's had 3 beautiful children, and she's going to tell you her story and how she thinks what she thinks she's got out of the Joint Lupus Obstetric Clinic.
Hi, it's been a pleasure to be invited to come and talk to everyone. Might make a fool of myself, but bear with me. Yes, I was diagnosed about 8 years ago with lupus, and it probably affected me more mentally. I've had really bad stages, good stages, but mentally it's affected me. It's affected my kidneys as well. But most important fact is I wanted children, and with the help of Dr. Jane and the obstetrician team and one-to-one with Jane, I've been able to do that. It's not been an easy ride. They've been with me like a family every step of the way. You know, they've never said, you can't do this. They've said, we'll take this, we'll turn this around, we'll just do this way. But they've always encouraged me and made me feel better about myself. You know, as lupus isn't well known to my family, it's like this, you know, it's not like a common disease like eczema or psoriasis where you can explain to people. Lupus is kind of hidden in one way, yet shown in some ways that you can't explain. You know, I could be, one day I can't get out of bed, you know, someone might look at outside view that, oh, she's just been really tired or she's lazy. If you know about lupus, it's part of the fatigue, you know. But, you know, the joint clinics through Dr. Jane's clinic 12 and the obstetrician, Dr. Lee's, I can't name all the names. Oh, I've got bad memory. That's part of the memory loss as well, so I blame it on that. They've been a fantastic help. Without them, I couldn't be where I am. You might think I'm a positive person, but I'm actually shaking my boots right now. They've been there, they've helped me through it, and they've been through the ups and downs. You know, with the scans, I've been on so much medication, up, down, steroids, been flying out of the roof. But, you know, they've seen me on a regular basis. If they've needed to see me extra, you know, they've called me in straight away. If I've had any problems, they're only a phone call away. I mean, I've had so many tears sessions with Jane on the phone. I was like, I'm sorry, Jane. You know, I feel like this is happening, that's happening. But she was like, don't worry about it. We're here for you. I just felt it was my second family, you know. Without Dr. Jane, the obstetrician, I wouldn't be here I am. I mean, it's all well showing, you know, the sums, the physics, but I think on a one-to-one basis, lupus is, you know, it's getting, you know, awareness has been raised, but I think, you know, we're just lacking in that as, you know, like these groups and sessions. I wish they were there for me at the beginning where I felt like I was isolated, but awareness is happening and there is help out there, but I don't think it should be hidden. It should be talked about. It should be expressed. The more you express your feelings, the way you're feeling and what's happening, you actually feel better. I got to a point where I was hiding to my family and friends that I was on medication. Then one day, it was after talking to Jane, it's nothing to be ashamed of. It's part of the illness. You have to either live with it, cope with it, or you can hide away and it can get worse to you mentally and physically. Being happy within yourself is about opening up, letting people come and letting them know what you're feeling, how you're feeling. It might take time, but that's all you need. You need the support from family and from the hospital. If I've actually moved to Cambridge, I was in Bury St Edmunds after this illness, because the support I was having from the hospital at Addenbrooke's, it's been fantastic. Without them, I wouldn't be where I am now, and I wouldn't have 3 beautiful children. So I'd like to thank them so much, because Jane's been fantastic. I feel like she's more of a friend than just a consultant or a nurse or everything. And they've always welcomed you with open arms. Any questions you needed answering, any thing you needed, they'll talk to you about it. I mean, half the medication I'm on, I don't even know their names. I'm just letting the doctors get on with it, kind of thing. Because that's how much trust I've put in them. They know me more than I know myself. They've said to me, you can have a life, you can get on with this. If you let the disease get to you, that's it, you can. But it's not the disease that controls you. You can control the disease. So I'd like to thank once again Jane, Dr. Lees, Dr. Jane, Dr. David Jane for everything and their help. And to me, having a family was a very important part of my life. And as you can see, they're not that small, they're a bit big now. They've made it possible. You can have a normal way of living, and you can have a fantastic way, and you don't need to feel like you're living in a bubble. So thank you once again, and sorry to have bored you.
I'd like to just thank Henna and Katie as well for giving up their time and coming up to talk today and being so brave and talking about their experiences. I'll just leave you with it. I think we didn't have Henna's husband up, and she wrote this beautiful poem about how she was feeling. I think this says a lot, so I just leave this up as your closing.
Thank you. I always like to hear from people like us. It makes a difference, I think. So Katie, Henna, thank you very much. And of course our previous speakers.